Board-certified plastic surgeons know you only get one chance for a good first impression, but that usually happens before they ever meet a prospective patient.
I always say hire on attitude, not aptitude, because I can really train somebody up if they have a certain level of aptitude, but I can't change attitude. So the right personality, to be good communicators, to be authentic, honest, real to my patients is by far the most important. I just recently hired a new administrator, and within a few minutes of the conversation, I knew she was the right balance and the sort of the really honest, authentic person I was looking for.
If the person who answers the phone doesn't give good phone, doesn't answer questions appropriately, or treat someone in a way that they wouldn't want to be treated, it's a negative interaction, and that's a patient that's potentially going to be lost. If they're either short with them, in a sense of just, do you want to make an appointment, kind of attitude, versus listening to them about what that appointment's about or what that potential patient is interested in asking.
Does the person on the other side of the phone like the person they're talking to? It really comes down to that.
You want someone who's educated, affable, and aligns with your personality and presentation. Also, part of that is they need to be trained. People don't come to this knowing exactly what to do and what our procedures are like. I believe it comes from the top.
The staff can make you or unmake you. They're the point of contact with the patient. They establish the relationship right off the bat. If it's a bad staff and a bad interaction, it's not going to go well, no matter how certified you are in how many fields.